Welcome to the Consumer's Guide to Mental Health. I'm your host, Dr. Margo Jacquot. I'm a licensed clinical psychologist and have been in practice for, a few decades. During that time, I have come to see just how complicated the world of mental health and finding resources can be. So many different types of treatments, so many different types of insurance to navigate. This podcast will break that down for you, understanding treatment options and navigating insurance to exploring resources and real-world strategies. Each episode gives you practical insights to support your mental well-being. Let's get started. Hi, everyone. Thanks for joining us. So glad you're here. As always, if you're a return listener, if you're new, so glad to have you here. And this is going to be an incredible episode. This podcast is designed for people who really want to understand more about how to discern what are the different therapy types, different options. So I have an amazing guest here today, someone very near and dear to my heart. Our guest today is Dr. Abby Brown. Dr. Brown is a licensed clinical psychologist specializing in perinatal mental health, fertility challenges, eating disorders, and disorders of emotional overcontrol. She's the owner of FlexPath, an outpatient telemental health practice, serving clients in Illinois and SIPACT member states. SIPACT member states, folks, is just folks who are psychologists. You can apply to have licensure. You can see clients across state lines, which if you don't have SIPACT status, you can't, which is another thing we can talk about on another day because that might be important in picking a provider who best suits your needs. At any rate, Dr. Brown is intensively trained in radically open dialectical behavior therapy, RO-DBT, and received a 2019 RO-DBT Clinical Scholar Award. She brings extensive experience from diverse clinical settings, including eating disorder treatment programs, large group practice, and university counseling centers. She is a past president of the Illinois Psychological Association as well, and I will tell you, is just a lovely, wonderful human being. So welcome, Dr. Abby Brown.
I'm excited to be here, and I'm excited about this new podcast you've got going on.
Thanks, me too. Yeah, this has been an exciting venture so far. I've been doing a business podcast for a while. This is something that I've been wanting to do, so I'm excited that you can be here to do this with me.
Me too.
So let's talk about RO-DBT. So for those who may be new to that term, RO-DBT, how does it differ from traditional DBT? What is it, and how is it different than DBT?
Sure, yeah. I'm sure that a lot of you have heard of dialectical behavior therapy. It's a really amazing evidence-based treatment, and it's commonly used in all kinds of settings and treatment centers and outpatient settings. And radically open DBT very much came as a result of the fact that DBT was not necessarily addressing certain issues and problems with a particular population. And so what's kind of interesting in the therapy world is we would call RO-DBT a pretty new treatment, although it has decades of research behind it and clinical trials, and it's been in the making for a very long time and has been used for a very long time. But in our world, it's quite new and it's very exciting. So, ultimately, the key difference is the target population.
You know what, Abby, if you don't mind, I think some folks these are folks who may or may not know about DBT. So do you mind just explaining a little bit about DBT?
Yes.
And then RO-DBT?
Sure, yeah. So DBT is a very helpful treatment for people who have disorders of under control, emotional under control. So these are going to be people who may have a diagnosis of borderline personality disorder. That's what you typically think of when you think of the treatment. However, it's really used across many different diagnoses and really very much helpful for people who struggle with impulse control, who have a hard time regulating their emotions and a difficult time communicating their internal experience to other people. So it's really a treatment to help kind of rein in and regulate difficult and intense, overwhelming emotions that are going to be causing some significant difficulties in their lives. So on the flip side, RO-DBT is to help people who have excessive self-control or maladaptive overcontrol. And that's what I'm going to be talking about today. It's going to be helpful for people with a range of different disorders like depression, chronic depression in particular. So people who have been unsuccessful in many different treatments that haven't worked for them. So it really can be helpful with treatment-resistant depression, anorexia, and obsessive compulsive personality disorder. So we see this very much characterized by an excessive need for control. We see this with perfectionism, and a lot of people who, because of their really high goals and expectations, will push through pain and strife and difficulty in pursuit of these long-term goals. Could be changing their bodies, it could be a range of different things, and can cause severe impacts to their well-being and ultimately their relationships. And so that's where we see a lot of isolation and depression, things like that.
That's great. So DBT, dialectical behavior therapy, has been used for people who have a hard time regulating their emotions, getting their arms around their emotions, feeling like they can make choices or can be in control of their emotions.
Yes.
And so they might have, as you said, impulse control. They might get in arguments with people more often. They might struggle at work because they can't keep their mouth shut. They might struggle at home because they will say or do things that storm out of a room, or something that is really something that maybe they wish they hadn't done.
Right.
And DBT can help people learn how to get their arms around their emotions better. Over-controlled people would be people who are perfectionistic, and they are afraid of making mistakes,
Yes.
doing anything wrong. Anything else?
Just, I think a lot of times we see this different ideas like, weakness is not an option. Failure is not an option. I'll talk a little bit here in a moment about the gifts of overcontrol and that it very much can be a superpower. So hang on, and we'll put a pin in that for now. But it certainly can cause problems when you just don't know when to stop, and when self-control kind of tips into this area of really the inability to know when to pull back, when to rest and take care of yourself because of these beliefs that have been reinforced over time. So those are, I would say, the differences. And ultimately, both of the treatments are aimed to help people kind of move into a bit more of a flexible range. So when and how do you apply self-control? And because there are certain contexts where it is very appropriate to be controlled. So, if you're in an airport, for example, probably not the best thing to scream and shout or, kind of throw a tantrum.
Right, if they can't rebook your flight that was missed.
Let's not do that when you're going through security. Right. Mm-hmm. So perhaps a time to employ some self-control. That said, other times where it might be better to self-disclose and be open and laugh and play, and that is how this treatment's going to be helpful in teaching when to apply those things.
Okay, great. So part of what you're talking about is, I can imagine some of you out there are listening to this and thinking, well, Dr. Brown, what on earth are you talking about? Drive and grit and stick-to-itiveness. I mean, our culture really supports those, right? And a
Absolutely.
lot of successful people do those things. So what's the problem with that?
Well, I mean, that is the crux of why this treatment is so important, because there are so many people out there that are suffering in silence. They have such high expectations of themselves, and it doesn't matter what the cost is. And, we're seeing a lot of collegiate athletes die by suicide and experiencing, just even college students in general with the expectations they have academically and socially. But this need to be perfect, this need to get all A's and, be a high performance athlete, for example, and not let anyone see any of your suffering.
Or flaws.
Flaws.
Or failures.
Failures, humanity, the fact that no one is able to actually be perfect, believe it or not. And so I would say to those people, these are real assets. And again, in in certain contexts, striving for excellence is wonderful. It's a great thing, and it's something that gets people out of bed and is a source of social connection for a lot of people. The question is, at what cost? If you're unable to stop, if you're unable to take those breaks, as I mentioned, and if these things come at the cost of your relationships, that's also very critical. So I would say these are real assets. What we do in RO-DBT is also pinpoint what are your values related to your relationships. Because for a lot of overcontrolled folks, they will list their values: perseverance, excellence, control. These are things that can be really empowering, but they often don't have anything to do with anyone else. And it's great to be first place, but it can be really lonely there too. So I would say, who do you have around you? And do you have some close, intimate relationships? And are you able to balance the things that you care about and the people that you care about?
And take care of yourself.
Absolutely.
And take care of yourself, right? Okay. So, the words radically open, right? For folks who might hear radically open, that can sound like you're going to be doing a whole lot of oversharing. But I'm assuming that's not what that means.
No.
So what is the RO, radically open, all about?
Right. Well, I can appreciate that. I have a lot of people think like radical, what in the hell does that mean? Like, is this some kind of, hippy dippy treatment or something like that? The idea is self-disclosure is a part of radical openness and part of the treatment. A lot of people who are over-controlled keep themselves at arm's length from others. So they might share things to other people that they have sort of deemed safe. And it's really hard to feel close to people who keep you at arm's length. And it's really hard to trust people who don't share their inner experience, who don't share things that are hard and painful, and also who might not show what they're feeling on the outside. So what are they actually signaling to you? Because a lot of times over-controlled people tend to mask their feelings. They might show up with a flat face, perhaps. They might be somebody that's been called, they might be someone who has resting bitch face, who really doesn't show what they're feeling on their face. So,
or always have a smile.
Or always have a smile, right? So appearing that everything is okay and everything is fine when it's not. So self-disclosure and being open is key. What the mechanism of change is the idea that open expression equals trust, which equals social connectedness. So we tend to trust other people when they are open with us. Now, being radically open doesn't mean just self-disclosing for the sake of self-disclosing. The idea is that we share things like our self-conscious emotions. I mean, if you think about what are the things that we all share as humans, well, embarrassment, guilt, shame. If you walk around and you realize that your zipper's down and someone, says, hey, guess what, Abby, your zipper's down. Oh my gosh, I'm so embarrassed. It's something that is so understood, and we've all been there. And so when we can share those kinds of experiences, that's how we feel connected, and that's how others feel connected to us. And that's how we join in with others. And what we share is always context dependent. We want to be aware of, what are we disclosing to a colleague or a boss or a friend, and kind of being aware of, we're not saying you need to share your most kind of intimate fears with a complete stranger. But there are different skills that help you figure out when and how and what to share. The other thing about radical openness is ultimately it's about leaning into the things that we generally want to avoid, that we seek to avoid in order to learn and grow. And so it's kind of like when you feel prickly or when you feel your heart start to race and you feel flushed and something has happened and you're feeling really uncomfortable and you want to numb out or bail or disconnect. The idea is that using that feeling as an invitation to learn. There's something there that you can learn about yourself and how you see the world in that moment. So that's radical openness, is intentionally exploring what we call our edge. It's this place of new learning and kind of hanging out there for a bit and see what comes up. So for you OC people who are like, oh no, I really don't want to just be unleashing every single bit about me, that's absolutely not what this is. It's being deliberate about opening up and sharing with the intention of creating and sustaining trust with others and building those connections.
What a lovely description. And it sounds like RO-DBT treatment helps people do some discernment about how to do that, where to do that, when to do that. That it's not just, if you're listening to the podcast, this doesn't mean you go out and you just start sharing with everybody. That's not what we're saying.
No.
We're saying there is some discernment that will occur
Yes.
that they need to learn.
Yes.
So that's incredible. So how is the structure or feel of an RO-DBT session different or similar to other types of therapy that people might be more familiar with? You go in, you sit on your therapist's couch and go. You just tell them about your week. The therapist says, how are you? Or what's your week been like? Or what's been happening? How is this different?
Yeah. Well, what's pretty cool is there's individual RO-DBT and there are RO-DBT skills classes. So I want to just address the skills classes because they've done some research that's found that even if you can't find an individual RO therapist, if you join an RO skills class, that the skills classes alone are incredibly effective. So that's also something good to know, because while there are more of us getting trained in RO-DBT, you might be more likely to find an RO skills class. And what's great about SciPact is you might actually find a skills class that's being held in a different state virtually that you could participate in. So that's pretty cool. But the skills classes are based on a 30-lesson curriculum, and each class can kind of range from an hour long to 2.5 hours long, depending on the setting. And you're basically, whether it's in person or online, in a class, it's like a didactic kind of a class setting. Many of us OCers love to be students and love to learn, so it's really set up to be more of a class as opposed to kind of group therapy where you're sitting around and having to unpack and share all kinds of things. And that is based on a manual. So it's a manualized treatment. And each class, you're going to be learning different skills. You're going to be learning about how to activate social safety. So how do you kind of be able to engage in different social situations with a bit more ease and openness, because many of us kind of enter a lot of settings in a threat state, and that can lead us to be a bit more closed and closed off from others. So you're going to be learning a lot of different skills, mindfulness skills, and how your over-control can be showing up in your life, how to work on those things in the skills class. In terms of individual therapy, and I think it's a really great question, it's like, what does this actually look like? So I think it depends on the RO therapist, and it depends on kind of what you're looking for. Some RO therapists may kind of do RO-DBT light, where they're integrating it with other treatments. But if you're coming in looking for adherent RO-DBT with a therapist, it's going to look different than traditional psychotherapy, and that you come in and you're going to do some agenda setting with your therapist, which I think people like. They like to know what is ahead and what is my 53 minutes going to look like, my 60 minutes going to look like. So we're going to set the agenda. And ultimately, you're going to be looking at really pinpointing what your over-control looks like in your life. How is it showing up? And what we use is 5 different themes that help us pinpoint how over-control can look. So what we do is we look at, for example, rigid and rule-governed behavior. that is very common among people who are over control, but it can look really different. For one person, it can be that I have to do certain tasks before I leave my house in the morning. It could be the way that you stack and restack the dishwasher. So another one of the themes is hyper detail focused and overly cautious. So we're going to be pinpointing what this looks like for you. We're also going to be looking at what are the value goals that you have related to relationships. Because why would we want to address our over control if we're not really seeing it as a problem or causing some difficulties out there in the world in our relationships? So it's to really be grounded in, why do I want to work on this? And then we use diary cards. So once you figured out what your OC looks like, you're going to be tracking it. And you're going to be, during the week in between sessions, self-monitoring using some diary cards. When did it happen? What happened? What was going on? And then talking about doing some solution analysis. So where could we plug in, where you could use skills? What could you have done differently to signal more effectively, communicate more effectively? If you could go back, what would you do differently? And then you practice those skills in the subsequent weeks. And what's great is when you're tracking these things and you start to see, oh my goodness, I'm not really doing that as much anymore. And I'm not doing it as intensely anymore. So, I'm noticing I'm able to get out the door a bit quicker, or I'm noticing I'm not restacking the dishwasher, or I'm not checking somebody's work or going back and fixing something that I noticed that somebody did a little bit, not quite the way I would do it. So this is how it's going to look, is by monitoring through diary cards, solution analysis, and ideally you would be in the skills class while you're also in the individual therapy, so you can be learning those skills in the class and then applying them, talking about them with your therapist. So it's great because it's structured, and I think that really works well with the OC brain, and clients have really benefited from it.
I want to join. That sounds great. So as a good OC, over-controlled person in progress myself, why can't I just go buy the manual and do this myself?
Well, when Dr. Lynch and his colleagues wrote the manual, I think they knew that people who are OC would buy the manual because, we like to get the book and teach ourselves. Might as well. You can buy the book, but can you do this on your own? No. It is not something that you can just intellectualize. It has to be experienced and practiced. And the idea is that we're doing this. The benefit of a skills class is that it's many exposures. You are around other people and practicing self-disclosure, practicing opening up, taking risks without knowing what the outcome is going to be, and in time feeling the safety of a community. So it's not something that you can do alone. And ultimately, depression, for example, is such an isolating experience. And so, how do we get out of that? Well, that is through connection and through community. So we can't do the treatment alone. But sometimes for some people, their community is their therapist, is they're coming to therapy. And so start there. If you buy the book, that's okay. There's workbooks now that they've been putting out. And so I would say bring it to your therapist and start working on it with your therapist.
Yeah, I love that. So just anticipating some of you thinking, well, okay, it's a manualized treatment. Can't I just go get the manual myself? No, because part of it is, as you said, many exposures, many opportunities to be able to practice some of these skills with another human. So, and I'll tell you, I think one of the beauties, even as a therapist, I think one of the beauties of having a good consultant or having a therapist ourselves is having a space where we can say anything. And for people who are over-controlled, those experiences are probably few and far between.
Yeah.
So, what would you say is a myth that you would like to dispel, bust, do away with, and one truth that you want people to remember about RO-DBT?
Well, I think that there's a myth that RO-DBT is going to kind of force you to swing in the other direction. That you're going to go in, you're going to do this work and you're going to be completely out of control. You're never going to be able to have the ability to kind of discern between what you want. You're just going to be reckless and impulsive and just kind of a glutton. And I want to assure you that that is not the case. And what we are seeking is flexible control. And I would actually say, I mean, the truth here is that your self-control is a gift. It is a superpower. And they call it your superior inhibitory control. It means that you have this ability to regulate and kind of be able to inhibit your impulses in the spirit of whatever your goals are. And that can be an incredible thing. I mean, we need people like this. If you think about first responders, I mean, you've got a mission, and that is the priority. And so if you've got, a headache, that you're not going to be thinking about the headache. You're putting that behind you, and you've got to look forward and do what you're supposed to do. The idea is, how do we use the superpower for good? How do we tap into it and hone in on when to use it and how to use it? So that would be what I would say. We're not trying to get rid of it. We're trying to hone in, tap into it, and use it for good.
Use our superpowers for good. I love that. So, folks, just an FYI, and I've heard this many, many times over many, many years, that people do get afraid in therapy that they're going to lose something that is important to them, a skill, a way of being. A therapist, nobody can make you stop doing anything. No treatment can change you in that way. You get to choose in therapy what changes and what doesn't. I do EMDR, which is eye movement desensitization and reprocessing. We've also done neurofeedback for folks here at our practice, and folks have said, oh my goodness, I don't want my brain to change. I don't want to not be able to do whatever it is I do. So I'm glad you mentioned that, Abby, because this might be somebody's superpower. They might really appreciate some aspects of it, but you're going to help them figure out how to discern, how to know when and how to use it, and to use it for good in their lives. So Dr. Abby Brown, thank you so much. One final question for you. If somebody wants to do RO-DBT, how can they do so? Well, I guess this is two questions. And if they want to connect with you, how can they do that?
Awesome. Well, I would say the best place to go would be radicallyopen.net. That is the hub of RO-DBT. They're going to have resources. They're going to have, if you're a provider, they're going to have links and information on how to get trained. And if you are a client that's interested, there is a provider database. So it's very helpful. It has it by state and country. It's not just here in the States, but there are providers all over the world. And there will also be links on how to purchase some of the books and workbooks that they've got already released and coming out as well. In terms of how to get a hold of me, I do provide individual therapy as well as run RO-DBT skills classes virtually. And as a member of SciPact, you can be in, I think, over 40 of the states here in the US and participate. So you can find me at flexpathpsychology.com and you can get a hold of me there.
Folks, please do so. Abby's very, very skilled, I'll tell you that much. And we'll have all of that information in the show notes. So that, folks, is RO-DBT, and please take a look at it. I'm telling you, I've been doing this work a long time, and it's a treatment that I'm very drawn to and have thought, boy, this would be a great thing to know how to do as a therapist. So as a client, I highly encourage you to look into it. So thank you so much for joining us today. Wonderful to have you. We will look forward to being with you next time. Be well. Thanks for listening to the Consumer's Guide to Mental Health with Dr. Margo Jacquot. That's me. If you found today's conversation helpful, please be sure to subscribe so you won't miss future episodes. For more resources and information, check out the links in the show notes. And remember, mental health is health, and you deserve access to the support you need. Until next time, take good care of yourself and be well.